Michelle is 38 years old, a mother of three, working two jobs and always tired but never complaining, because that is just what mothers do. One afternoon, she felt a little nauseous, some pressure in her upper back. She figured she pulled a muscle carrying groceries again. She took some ibuprofen, put the kids to bed, and went to sleep. 3 weeks later, she went to her doctor for a routine checkup. Standard ECG, 5 minutes, no big deal. The doctor looked at the results, then looked at Michelle, then looked at the results again. "Michelle, you already had a heart attack." She laughed, said that was impossible.
I never
No
had
chest
any
pain,
chest pain.
no ambulance, no dramatic moment.
Nothing like that
Nothing.
happened to me.
The doctor pointed to the
happened.
printout. It
Right
happened. Right
You
here.
can actually see the scar.
We
on
can
your
see
heart.
the scar on your heart. Michelle had a full heart attack while putting her kids to bed, and she thought she was just tired. She is not alone. She is one of thousands of women every single year who survive a heart attack they never knew they were having. Here is why, and what you need to know before it happens to you. 45% of all heart attacks are completely silent. No chest pain, no left arm pain, no warning, nothing. The American Heart Association studied over 9,000 people over a 10-year period and found that nearly half of all heart attacks detected on ECG scans had never been reported by the patient, never diagnosed, never treated, never suspected. These people had a heart attack and then just carried on with their day. Made breakfast, picked up their kids, had arguments about what to watch on Netflix, just like Michelle. As terrifying as the data sounds, we need to talk about the fundamental flaw in medical research that put women like her at risk for decades. For the better part of the entire 20th century, almost every major heart attack study was conducted exclusively on middle-aged men. Not women, not people with different hormonal profiles, just middle-aged men being studied by other men in lab coats who then wrote the textbooks every doctor on earth was trained from. And from those studies came the textbook definition everyone knows. Crushing chest pain, left arm goes numb, cold sweats, dramatic collapse. That is the male presentation. Accurate for men, and almost completely useless for women. Because women present with nausea, extreme fatigue, upper back pain, shortness of breath, an inexplicable feeling that something is catastrophically wrong, none of which looks anything like the Hollywood heart attack, all of which gets dismissed as stress, anxiety, or just being tired. Women are twice as likely as men to be sent home from emergency departments during an active heart attack. Twice, because their symptoms do not match the template the doctor was trained on. This is the framework that failed Michelle before she ever walked into that checkup. Before we go deeper into Michelle's story, you need to understand exactly what a heart attack actually is. Your heart is a muscle, and like every muscle in your body, it needs a constant supply of oxygenated blood to survive. That blood is delivered through a network of arteries called the coronary arteries, sitting directly on the surface of your heart, like a system of pipes keeping everything running. Over years, sometimes decades, those pipes can accumulate a buildup of cholesterol, fat, and inflammatory cells on their inner walls. This buildup is called plaque. It grows slowly and silently, with zero symptoms, zero warning. Then, one day, without any notice, a section of that plaque ruptures. Your body panics and sends blood cells rushing to clot the area. But inside a coronary artery, that clot does not heal anything. It blocks the pipe completely. The heart muscle downstream stops receiving oxygen. Within 20 minutes, those cardiac muscle cells begin to die. Permanently. They do not come back. They are replaced by scar tissue that cannot pump, cannot contract, and cannot contribute to your heart function ever again. That is a heart attack, not a dramatic electrical malfunction, Not your heart stopping, just a blocked pipe, killing muscle, silently, sometimes without a single symptom. Which brings us back to Michelle. When the doctor asked about her family history, the picture became very clear very fast. Her mother had type 2 diabetes. Her grandmother had type 2 diabetes. Her aunt died of a heart attack at 52. Michelle herself had been told 2 years earlier her blood sugar was pre-diabetic. She was given some leaflets, put them in a drawer, forgot about them, because she had 3 kids to feed and 2 jobs to get to. Pre-diabetes silently damages cardiac nerves over years, the nerves that transmit pain signals from the heart to the brain. When those nerves are damaged, the pain signal from a heart attack never arrives. Her heart was screaming, but the phone line had been disconnected years before she ever needed it. This is called cardiac autonomic neuropathy, and it is why diabetic patients are 2 to 4 times more likely to have a completely silent heart attack than anyone else. There is a specific profile of person most at risk, and millions fit it without knowing. Family history of diabetes. Just like Michelle, the cardiovascular damage begins years before any formal diagnosis is ever made. Being a woman, the entire diagnostic framework was built around men. Women's symptoms are real, documented, and dangerous. They just do not match the template. Race. Black women in America develop heart disease on average 10 years earlier than white women. Nearly 57% of black women over 20 have high blood pressure. Black Americans are 60% more likely to be diagnosed with diabetes. Michelle carried every single one of these risk factors simultaneously, and the system consistently failed to flag it. Chronic stress and exhaustion. 2 jobs, 3 kids, no time. Chronic stress elevates cortisol, which promotes inflammation in artery walls and accelerates plaque formation. Michelle's lifestyle was not just exhausting, it was biologically dangerous every single day. In the weeks before her heart attack, Michelle had been experiencing symptoms she dismissed as the price of being a busy working mother. Extreme fatigue that sleep did not fix. She blamed the 2 jobs and the kids and the mental load that never switches off, even when you physically stop moving. Nausea that came and went. Took antacids and carried on. Pressure between her shoulder blades. Assumed it was the heavy bags on her commute. Booked a massage she never got around to having, because of course she did not. Shortness of breath climbing the stairs. Told herself she needed to exercise more. Added it to the list of things she would do when life slowed down. The list is currently 14 pages long. Life never slows down, and hearts do not wait for the list. If you experience sudden extreme fatigue, nausea, upper back pressure, shortness of breath, or an overwhelming sense something is wrong, 3 or more simultaneously, go to the emergency department immediately. Ask for an ECG and a troponin blood test. Michelle found out by accident. A routine ECG that was not even looking for a heart attack found the evidence anyway. A previous heart attack leaves a permanent electrical signature on every ECG called a Q-wave abnormality. It does not go away, ever. A high-sensitivity troponin blood test detects the protein released when heart muscle cells die. This confirms an active or very recent cardiac event. A cardiac MRI identifies areas of scarred heart muscle with extraordinary precision. If you have a family history of diabetes, if you are a woman dismissing fatigue and back pressure as just being tired, if you are a black woman over 30 with hypertension in your family, if you have never had an ECG and you are over 35, book one this week. Not next month, this week. Know your 4 numbers: blood pressure, blood sugar, cholesterol, fasting glucose. These are your cardiovascular dashboard. If you do not know all 4, you are driving your body completely blind. Michelle went back to her doctor and said something she had never said to anyone in her entire life. I need help. I cannot do this alone. Today, she is doing well. Today, adherent to her diabetic medication with daily blood sugar monitoring. She also checks her blood pressure every morning before the school run. This is where we end off this video. But remember, your busyness is not armor. Your strength is not invincibility. And the symptoms your body sends you deserve more than a leaflet in a drawer. Life never slows down, but your heart will. Share this with every woman in your life who is tired, busy, and putting everyone else first. It might be the most important thing you do today. Follow Med Unlocked for the medical facts that could save your life and the lives of the people you love.